Welcome to Afternoon Tea. I'm Dr. Linda, an emergency physician, and I'm here with my co-host, Dr. Erica. She's a GP, and we are both lifestyle medicine physicians. I'm from Sheffield, and she's from the West Midlands. Let us know in the chat where you are dialing from and what is your favorite tea.
Right, so every Sunday we set out to inspire and empower you to enjoy good health by sharing fad-free information, by bringing experts to the table to create life-changing conversations over a hot cup of tea. In the audience, we have people from all walks of life, including patients, healthcare professionals, and also people who are just interested in healthy living. So we encourage you all to ask questions, and there is no such thing as too simple a question. So please don't feel intimidated. And this platform really is for anyone and everyone, and we can all learn from each other. And actually, it's particularly interesting and helpful for healthcare professionals to hear from non-medics and the sort of questions that you might have.
Did you guys know that most of the 89% of chronic diseases such as diabetes and heart disease are actually preventable and sometimes even reversible? Genetics are not our destiny, and evidence-based lifestyle medicine is the growing specialty that addresses the root cause of these diseases to prevent, treat, and reverse these diseases. Today, we will be talking about one of the 6 pillars of lifestyle medicine, social connections. In particular, we will be talking about the impact of loneliness and how to combat it, especially during the pandemic. And we are delighted to bring you 2 guest speakers today, Dr. Natka Musial and Dr. Siobhan Carver. Both of them are GPs from London who have seen the devastating impacts of loneliness.
Dr. Natka Musial has rotated through various specialties, including internal medicine, sexual health and HIV, obstetrics and gynecology, pediatrics, psychiatry, and emergency medicine. And she's noticed that no matter how different specialties were, all roads lead to lifestyle medicine. And she feels passionate about lifestyle medicine and loves sharing happiness and health in exercise, nutrition, and self-care.
Dr. Siobhan Carver is a member of the Royal College of Physicians and also has a master's in pharmacology and the history and ethics of medicine. For the past 5 years, she has worked in and around London, both in hospital and in primary care. She learned that the lifestyle medicine approach is the one that unites us all by making sure that we put ourselves and our health first. When not working, you can often find her traveling, baking, playing the ukulele, or trying to learn new skills with passion and enthusiasm.
Dr. Natka does 5-minute live workouts every evening on Instagram. So to warm us up for today's session, she'll take us through a simple stretch that you can incorporate into your daily routine, especially if you work at a desk like us. Or like
Right, okay. So hello from me. Thank you very much for having me over. So I would encourage you all to now stand up. Okay, very good. So let's put our arms up. Very good. Now let's reach behind us. And let's reach behind the other side. Very good. Let's not forget our feet. And let's rotate our feet. And the other one as well. So these are just very simple exercises, but they're really effective. They're not only effective for our muscles, but they're also effective for our mental health. Happy hormones are being released when we move our body, and this might only be 5 minutes per day. So I do encourage you to think about that every day. Have you moved your body enough?
Thank you very much, Natka.
Well, so today's chat is a little different as Natka has actually prepared a PowerPoint presentation for us today. So we'll start with that. And of course, you'll have a chance to ask questions afterwards, like always. And if we don't have enough time to answer all the questions, we'll respond in a future video or in our newsletter. So I'll hand that over to you, Natka.
I hope everyone can see the presentation.
Just make it a large screen. Yeah, play.
Sorry.
Just push play, so then
There we go.
Excellent, thank you.
That's it. Right, so after this little exercise session, I suggest let's talk about loneliness. So let me tell you about Finn Kitson. Finn Kitson was a 19-year-old boy. He started uni in September at Manchester University. He was really, really excited about that. He was also a very keen Cambridge City FC football player. So everything started well, but then he had to go into isolation because someone was tested positive for COVID. So he went into isolation. That means he couldn't join any clubs, couldn't have any lectures face-to-face, everything went online, couldn't even go to the supermarket. He was basically just receiving daily food boxes. And he could only speak with the people in the flat that he didn't know. So then by the beginning of October, he started becoming more and more anxious. And then people stopped hearing from him. Finn was found dead in his flat. Now we obviously see young people struggling with anxiety, especially freshers, when they face this new challenge in their lives. But 2020 is a different level. We are facing loneliness so much more differently that we are not prepared for it. The ONS has done a survey in autumn 2020 that showed that more than 1 in 5 students said their mental health was much worse. 63% actually felt that COVID posed a significant risk to their mental health. The NUS poll showed that 52% reported that their mental health had deteriorated, but only 29% really sought any help. And if they did, only half of them were really happy with the help that they received. If we go back to the other scale of the age, we see that elderly people, they're already more lonely. But this year, it was even harder. They couldn't see their families, they couldn't see their friends, they had to shield. Now Christmas is coming up. Surveys have shown that twice the number of people as normal will be spending Christmas alone this year. Putting that into numbers, this is 1.7 million people who will be spending Christmas alone at the age of 65 and over. And this has doubled to 14% in comparison to the previous year. Now, are we actually that surprised that the World Health Organization has deemed mental health the silent pandemic this year? I don't think we should be surprised about that. Looking at data, depressive symptoms have gone up, and also substance abuse has gone up. Unfortunately, treatment has almost disappeared. Mental health services are being closed, being replaced by COVID treatment centers. Face-to-face appointments are being reduced, and walk-in clinics have closed. This is Dr. Tedros. He's the medical director of the World Health Organization, and this is the statement he issued in May of this year. So, but why do we actually need social contact? What's behind it? And I'm wondering, have you ever heard of the 7-38-55 rule? This rule shows that 7% of all of our communication comes through verbal communication. 38 is the tone of the voice. And 55% comes from body language. These are the 3 components we need when we interact with other humans. These are the 3 components that we need, that our brain needs to develop and to be happy. Now let's look at the brain. So you see the blue part. The part is the frontal lobe, which is right here, essentially. And this is where our brain processes what we think, what we feel, and what we should anticipate. Then it brings all the information together in the insula. And then when we look at the temporal lobe, this is the orange part, this is where all of our associations are happening with objects, with persons, with experience. And this is where we're combining facial features as well. What happens in the isolated brain? Research has shown that loneliness leads to shrinking of parts of our brain, and especially the frontal cortex. And not even big areas like the frontal cortex, but also really small areas like the pea-sized amygdala area, which processes emotions, can shrink because of loneliness, and stress hormone levels can increase. Stress hormone levels such as cortisol, for example. And why is all of that important to us doctors, as well as patients, as well as our family and everyone else? It's because loneliness is a significant risk factor for heart disease, for hypertension, for stroke, you name it. And why is it? Is it because the stress hormone level, cortisol, is released and then leads to a process of chronic inflammation. So the body is constantly on high alert, which drives up your blood pressure, which drives up your respiratory rate, and it's just a constant stress. It has an impact on things like sleep. That has an impact on anxiety, and that all has an impact on healthier life choices. Even the amount you move during the day. If you're not feeling motivated, you're not going to do it. And therefore, the pressing question is, what do we do differently in 2021? How do we make the next year less lonely? We will talk about this in this chat today, but just some things to brainstorm. We can all be a bit more creative. We can be a bit more open-minded. We can be a bit more noisy, asking our friends and family, are you really okay? And just be interested. How does it feel for my friend or my colleague to do what they do? Thankfully, we also have quite a lot of resources and that are free. And do you remember Finn, the boy I spoke about right in the beginning of my presentation? Friends of Finn have raised £26,000 for the Calm app. So that's good. So then more and more people can be helped. Thank you.
Thank you very much, Natka. That was fascinating. If you guys have any questions about this as we are moving along, please make sure that you comment in the chat. Don't be shy. Shoot those questions. So we're just gonna reshare our screen with our guest speakers. Excellent, and everybody is back. Fantastic. Thank you again, Natka. So our first question will go to Shavon. Hi, Shavon. can I ask you, what is loneliness? And is it just really a feeling?
Yeah, it's a really good question, Linda. So firstly, I just want to say thank you to Erica and Linda for coming up with this idea, because it's a really, really important thing to talk about. And thank you to everyone else for tuning in on a Sunday evening. So what is loneliness? Well, simply put, it is just there being a discrepancy between the amount of social connections that we need, that we desire, and what we're getting. And actually, there are different types of loneliness. So you've got emotional loneliness, which is when there's a lack of connection between you and a specific person, so your partner, your children. There's social loneliness, which is that wider circle of close friends and family. And then there's existential loneliness, which is where you feel separated from people so much that actually it's something within yourself. And as to your question about whether it is just a feeling, I mean, all you need to do is take a quick look at the stats. So loneliness has been shown to increase your risk of dying early by 30%. And actually, it's as bad for you as obesity. It's as bad for you as smoking 15 cigarettes a day. And that's huge, and that's really scary. If you need any more convincing, actually in 2018, the UK government appointed its first minister for loneliness. And to date, they've put in £11.5 million to tackle this problem. And sadly, I think if there's something we can all agree on, it's that they wouldn't be doing that if it was just a feeling.
Thank you very much. It is staggering, the statistics, and it's really very scary. Thank you for that.
Right, and I think, sorry, Natka, could you tell us whether people, because nowadays we're surrounded by social media, can people still feel lonely when they're surrounded by social media? And even if they're surrounded by people, I mean, not so much in the pandemic, but generally speaking, can they still feel lonely?
So that's a very important question. We are all surrounded by social media, and the amount of websites and apps that come up seems to be doubling every day. So this is one issue. We feel the need to connect more and more and more to feel less lonely. Whereas before all of that, we were just fine. So there is the pressure that you put on yourself to be more and more social, sometimes even more than you need to. Let's look at introverts versus extroverts. Both character traits need social contact, but to a different extent. Whereas some people might feel great being surrounded by 50 people, other people will be feeling intimidated by that. So whereas I feel social media is pushing everyone to a maximum amount of exposure to social contact, which can lead to anxiety. It can lead to the feeling of jealousy, and it can also lead to a lack of self-confidence by constantly comparing yourself. So social media has been great to one extent, but has also been a curse this year, as there was such an overload of it. And it was not in relation to any natural contacts we usually have, by just talking to our neighbors, by just having a light conversation where we don't have to prove ourselves. So I think one thing in 2021 is to find that balance for yourself.
Perfect. Thank you very much, Natka. Exactly, the balance is super important. Yes, Siobhan.
I was just going to say, if it's okay to just add to that point, I think one of the other key issues with social media is that it never turns off. And so actually it affects the rest of your life. And what all the research has shown is that what makes you feel lonely, what really affects the quality of our social connection with other people, is the quality of the time that you spend connecting with other people. And I think that we can all say that we're guilty of multitasking when we're talking to the people we care about. Are we really paying attention, or are we checking our emails? Are we thinking about the patient that we saw for us at work, or the meeting that you have next in your job? And actually the other person can really feel that. And so having a lack of social media when you are trying to connect with people is what's really key, because having good social relationships, it's been shown to be more powerful than anything else that we can do in our lifestyle, than our diet, than exercise, even than giving up smoking. But unfortunately, we've put it so far back in our priorities that what we do is we think they're just expendable, and we don't give it the respect that it deserves, and that's just not fair.
It can also perceive a false sense of security. You can think, oh, great, I've got 300 friends in my list on Facebook. But when something goes bad, you don't actually know who to call. So you should not, I think we need to be very, very careful about how we use social media and how confident we feel that we actually have quality in our friendships.
Yeah, absolutely. I think, you know, what Shavon said was great about the actual connection. And I say, you know, sometimes our presence is actually the greatest gift to the other person, because when you are present and you're listening and you're actually connecting with that person, it really comes across. And sometimes that's the best thing you can give to that person that you're trying to talk to or connecting with.
Exactly. And there was a question just about how do we encourage our elderly to connect. And I think whilst on this, neither on this show, and we don't have a way of allowing each other to meet each other, but what we can do is to change the way we connect with them. So when we do talk to them, we really make sure that they feel our presence in that conversation. We really go deep down and ask how they're doing, what are they doing, and so that they feel that connectivity, that sense of care in your voice, that can be maybe a bit theatrical, but we can achieve this over the phone if we really show our attention. And I think that can shift from I'm on the phone to I am listening to you, I am here for you. And I think, as all of you mentioned, being there is the key and is the secret in the pudding.
And there are also other ways we can get more creative with the way we interact with our family and friends. You know, there are postcards, not only from holidays, you can send them. There are little gifts you can think of, even if it's just a few biscuits. It's worth more than anything if the other person feels that you actually care for them.
Very good point. Very good. Natka has already talked about what is happening in our brain and the stress hormone when we are lonely. So Siobhan, can you tell us a little bit about what is happening when we are socially connected, physiologically speaking?
Yeah, absolutely. And Natka has gone into kind of the physiology of loneliness and how it affects our brains. And it's really just the opposite of that. So when you have these deep, meaningful social connections with people, well, actually, it changes your entire biochemistry. So it releases endorphins, it releases oxytocin. And for those people who aren't familiar with what that is, essentially, those are the hormones associated with compassion, with kindness. And they wouldn't be there just in terms of evolution if we didn't need them as part of our life. Humans were never meant to be alone. We were never meant to be by ourselves. If we go back, tribes used to work together, and being a part of something gives you a sense of joy, a sense of fulfillment that you just can't get when you're by yourself. It is clearly a fundamental need. We are an interdependent species, and now we can use the benefits of social media, just like you said, Linda. We can use everything that we have to connect with people on so many different levels. Actually, if we look at the positives, you can connect with someone on the other side of the world. Mm-hmm. And that's incredible. But it's what we're saying, it's giving everyone that time, and you don't want to feel like you're not being listened to. Because if you're already starting to feel lonely, if you're having that transient loneliness, then not feeling heard and not having those deep connections is how we get to chronic loneliness, and how you get that low-grade inflammation, which increases your risk of so many other conditions.
Natka also covered some health hazards related to loneliness. Is there anything else you would both like to add to that in your practical experience as well, what you see in your GP practices?
So it's very important during any consultation to show the patient that you connect with them. And questions like, what do you enjoy doing during the day? How does your day look like? Is by all means not a question that should be left out. You can only really help a patient if you know the patient. You know, you can give out the pills, you can give out the prescriptions. That's not a problem. That's not an issue. But is this the right choice for the patient? You need to ask yourself. Let's take a depressed patient, for example. Fine, you start antidepressants, you signpost to the right services. But is that really enough? And it actually is not enough, because you need to work on your mental health from the morning till the afternoon, essentially. You need to care for it like you would care for your hands by using hand cream. So that's why it's very important that we actually really get to know the patient that we have in front of us. What do you enjoy doing? And if they say, I really enjoy walking, then you explore this further. And this might go out to my doctor and nurse friends as well. Don't be afraid to prescribe that. Don't be afraid to prescribe 5 minutes of walks every day, or 5 minutes of exercise. Don't be afraid to prescribe reading, taking time to read your book for 30 minutes per day. This is all part of treating our patients. This is all part of combating chronic diseases, because we are now at a point where we are not on top of the chronic diseases, where they are growing us. So that's why we need to actually go back to the roots. What does our patient like to do?
Yeah, so that's so interesting about the prescribing, 5 minutes of movement or whatever. And I know, Shavon, you've recently been on the social prescribing course. Do you want to tell us a little bit about that, and have you actually used it in your clinical practice?
Yeah, absolutely. I use it every single day. And I think one of the key problems is that people feel they can't call their GP saying that they feel lonely. They don't think that's an okay thing to do. But actually, all the studies show that what GPs think is that about 20 to 25% of our consultations are because people feel lonely. And that's a huge discrepancy. But when people call me up to speak to me about it, they apologize. They say, I'm so sorry, I'm wasting your time. And they're not. And what people don't appreciate is that loneliness manifests as the root problem, like you said, Natka, in so many chronic illnesses that actually, I think, Linda, you must be seeing it in A&E too. All the chest pains that are secondary to anxiety, that are secondary to being alone and feeling lonely. The chronic headaches, the chronic tummy pains, and also the high blood pressures, the diabetes, the dementias. Actually, they're not all caused by lifestyle problems, but a lot of them are, and a lot of them at least are contributed by that. And what I learned from the Prescribing lifestyle medicine course, which I would encourage any doctor to go on, is that exactly what Natka said. We need to be looking at people as a whole. We need to be asking them, tell us about your day, tell us about your entire day, so that we can find small parts that we can slowly tackle. And when I've done that, what I found is that the key problem is a lack of social connection. It is as simple as forcing yourself to go out to buy milk every day, or bread, or whatever you need, so that you get out. Because at the moment, working from home, having kids at home, it's so much harder, and it's really easy to go through your whole day and you don't see any daylight. And that is terrible for you. It's terrible for your physical health. It's terrible for your mental health. So what I really want people to understand is, please don't be scared to call your GP to talk about this. We are not just here to give you your antihypertensives and your diabetic medications. No, that's such a small part of what we do. We are here to help you through your life in every way possible. So please call us. We are happy to guide you in the right direction. Otherwise, what's the point in us being there?
Nice.
Otherwise, it could just be a robot.
Exactly. Good, indeed. And I love how you mentioned in A&E. I think from a loneliness point of view, especially now, more and more people are coming in, which is with disguised loneliness, with anxiety that then translates into chest pain. So they feel that they are entitled to come in with a chest pain. So they come with that. And in the background, all it is that they want to have a chat with someone. And once, of course, we rule all the problems in A&E that are life-threatening, such as heart problems, lung problems. After that, I would like to encourage both our colleagues and patients to take on that 5-minute chat, to connect with each other, to sit down and say, are you okay? Is everything all right? What has been happening at home? Would you like to have a chat? Just talk to me. I would love to hear your story. It takes only 5 to 10 minutes, but it doesn't only improve the quality of our patient lives, and they will go out with a smile knowing that maybe it was the first time that year that somebody listened to them. And often with my patients, I do get that feedback when I do ask these questions. They do tell me, God, nobody listened to me for years. No one cares about me. It's the first time. Thank you, doctor, for making me present, for making me feel like I'm a human being, that someone cares enough to hear me. And those are the words that, as a physician, it helps you not only to do your job well, but those words give me so much that day to be present with my patient, that since I am present with my patients, I'm also protecting myself and improving my feelings on burnout, as physicians are lonely as well. But as soon as we have that interaction, I feel that I'm a human who is making a difference, and that pays back a capital 100 times than a salary does. So I'd encourage all of you physicians to try it out. It's pretty addictive. It's pretty good.
I also feel we should lead by example. We should not only try the best with our patients, we should also try the best with our colleagues, with our friends, with everyone. It doesn't stop really at the end of the consultation. It should become a habit and not another thing we have to do at work. Oh no, I need to talk to my colleagues. We need to, it should just be a natural. And one thing that the pandemic has shown as well is that quite a lot of people sit and eat lunch by themselves, for example, at work, whether they go into work or not, but not leaving your workplace for even 10 minutes. It just reduces the productivity on the one hand, and on the other hand, it definitely doesn't release any happy hormones. So just to the contrary. So therefore, I would encourage everyone to look around at work as well, to pull people with you, to encourage, to smile, even if they're too busy. Just smile at them. Kindness will bring the way. But yes, Linda, you mentioned loneliness at work. It can definitely happen. It can happen in a busy A&E department when you're surrounded by people. It can happen when you're not surrounded by people. There are no rules to that, but it's about whether you take some time during the working day to go inside of you and say, actually, oh, that was an interesting case. I really enjoyed that. Or whether you just power through like a machine. So yes, loneliness does exist at work, regardless which job you do.
And actually, just touching on what you said, Linda, and also a question that's just come up in the chat from Alison. I think you're totally right, Alison. So she's just asking about how, if people are feeling dissatisfied with their consultations, and I'm not sure if you're saying that from the patient point of view or from the doctors, but I think it's both. If you ask any doctor why they went into medicine, what the best part of their job is, it would be connecting with people. It would be the joy they get from helping people. And actually, unfortunately, over the last couple of decades, we've been hugely disempowered by the government, by the paperwork, by QOF, by the 4-hour wait time in A&E. And what we've lost is that beautiful relationship between the doctor and the patient, where you trust us as you should, and we are able to give you everything that you need. And if you're saying it from a patient point of view, I just apologize to you, Alison, because I never want someone to feel that they're being rushed or that they're being pressured. And I think if you're a doctor out there listening to this, just remember why you went into medicine. Remember what makes you happy. And actually, even though it may take a minute more per consultation, not to multitask, your patients will hugely feel it clearly, but also you'll get to the end of the day and you'll feel happier and you'll feel more fulfilled. And then you're much less likely to burn out, just like you were saying, Linda.
And exactly why afternoon tea with docs was created, because we want to have more time with our patients, parents, and family. And there is no point for us knowing about things if we don't have the time to talk about it with our patients. So this platform is really here to have open conversations where we can have the time, unlimited, not 10 minutes per consultation, and we can ask questions and feel comfortable and heard, because we really do care. And that's why we are spending the time 2-3 hours a Sunday to be here for everyone, and to hopefully create a message that we should bring this into our daily practice. So thanks for everyone being here.
It's okay to just answer one of the other questions in the chat about social prescribing. I think it moves on to what you were going to talk about next, Erica, which is the resources out there for people. And actually, what I was mentioning earlier about the UK government getting a health minister, well, actually, one of the huge things that they did was create the post of a social prescriber. It's terribly named because they're not going to hand you a prescription to sort out your social life. That's not what they're doing, unfortunately. But what they're doing is they are taking that huge wealth of knowledge out there, because there are so many resources, charitable but also funded resources for people, befriending projects, getting people into phone calls, getting people into knitting clubs, dance clubs, anything that works for the individual. And what they have is 1 hour appointments with patients. So if we're going back to the 10-minute problem, an hour is huge, and they can see them multiple times. And I've seen the power of what they can do. They can take chronic health problems and cure them just by getting rid of loneliness. And they are able to have the time to sit and speak with you as an individual, to really look at what you need and then highlight the right areas for you locally, what will work for you based on what you want. Do you want to use technology? Do you want to physically go somewhere? Are you able to physically go somewhere? They can also arrange transport. They are incredible people and they are so powerful. And so anyone who is struggling at all, I would really encourage you to call up your GP practice and ask for an appointment. You do not need a referral. They are there and that's what they're there for.
Amazing. In A&E, this is not advertised. I don't think a single doctor knows about really what they do and how we can utilize them in our service. Because certainly we don't talk to our colleagues like, yeah, why don't you refer this anxious patient to a social prescriber, to their GP? That conversation just doesn't happen. So I hope after this, a few of us, and I particularly will use this. So thank you for this information.
We've also had a comment in the chat box that it is okay to book longer appointments with your GP. And I think this is a very important fact. GPs don't cut their patients off at a 10-minute mark. The first appointment, obviously, you often don't know what your patient's issue is. But once you find out, we adjust. So don't be afraid to say more things. Even if we run out of time, we can always book a follow-up appointment or call you back later on. So COVID actually has brought more flexibility to GP appointments. We can now communicate with patients via text message, via video, via telephone, via face-to-face. We can send a lot of links out that will help the patient in the meantime. And GPs usually get back to their patients within one day, basically on the same day, which was unheard of before March. So I would encourage everyone to use the resources to open up to our new world of GP. Obviously bear with us because the workload has doubled basically, but we have the resources and we should be using them.
And well, you both have mentioned resources available. So as a patient who is lonely, how do they access these resources? I know you've both researched a list of resources which we could post on our website and in our newsletter to be sent out to you. But other than speaking to their GP, asking for an appointment with their social prescriber, is there any other way that people can access resources to help with loneliness?
So there are ways such as self-referral to talking therapies, for example, where patients can absolutely bypass their GP and do that themselves. There are free websites, and one of my favorite websites is called Wheel of Wellbeing, and it is based on evidence-based lifestyle medicine, and it explains that a human can't be happy and healthy if different areas in their lives are not fulfilled. If you're not eating well, how are you supposed to feel well? If you're not sleeping well, how are you supposed to feel well? If you don't have any social contacts that are of quality, then this area is blank. So it outlines with colors, and colors are always good, how our human body has been designed, how it works, and then it also signposts what is there available in the local area. So I send the link to this website to almost everyone who I speak to, because it is just such a valuable addition to care for yourself. It is self-care essentially.
Do you mind sharing that with us in the chat?
Yeah.
Great, thanks.
We also will be posting the Walk with a Doc, which is an organization where multiple doctors across the whole of the UK actually are volunteering to walk with their patients. We'll have a list of doctors in the UK, and I'm conducting walks here in Rotherham, Sheffield, Peak District area. So if you're in this area, then do join me. We'll go out for a nice 3-4 hour walk in nature. We can connect, talk, chat, nothing scientific, just fun, and with a hot cup of tea on the top with a few cookies. So we'll have the dates on the website where you can join us in the Peak District coming next year. So that will be loads of fun. And also the other doctors who are in different areas of the UK. So you can join them as well. It's completely voluntary. We'll just do it for you guys. So yeah, let's have a look at our website for all of these resources, and everything that Shavon and Natka has mentioned will be there under resources. Also to comment that if you want to continue the chat with us, make sure that you go on the website and look at our new forum where we can continue the conversation with our doctors. And if anything pops up, you have a question, you can post it there.
And this also concludes the power of movement and health impact. So not only the stretching exercises or any other exercises you like, but also things that people do in the community, like dancing, for example. I know this is a very difficult time for joining any clubs or anything like that, but this will definitely come back in the future. But some doctors, and amongst those is a friend of mine, and she's called Dr. Dancing, and she publishes dancing videos, simple choreographies to really nice songs to join in. So there is a lot out there, and that's why in one of my slides I wrote, be open-minded, try and look around and use it.
Yeah, and just to add to that, I think it is really difficult when there are so many resources out there. So I would look local if that's what you're trying to get at. So local charities, local churches are often really, really good at coming up with befriending projects and getting you in contact with people. But actually, although we're talking about kind of formal resources here, it doesn't have to be that complicated. Really, what we're saying is it's all about deepening our social connections, and you can do that with people around you. You just need to do it well. And what all the research shows is that if we're looking for an antidote to loneliness, then really what that is service to other people. Although that might not be initially what you think, what happens when you're chronically feeling lonely is your focus goes inwards into you. You start to feel more self-conscious, your stress level goes up, and you start to feel broken, essentially. But what happens when you start having positive connections with other people is it gives you a sense of worthiness and actually being accountable to another person. So for example, a regular phone call with an old friend that you've lost in touch with, actually being accountable to that person makes you feel better about yourself, and it builds your own self-esteem, it reconnects you and it regrounds you. So you're doing something for someone else initially, but actually you're doing it for yourself. So if you don't think that kind of resources with people that you might not know, although Natka's saying we'd really encourage you to be open-minded, if that's not really the way you want to go, then reconnect with the people that you have in your life, even old friends. This is definitely the time. If there was ever a better time, it's coming up to Christmas. There's a pandemic going on. No one will not want to hear from you.
Or just reconnect with anyone that you see every day. You know, take a notice, who is your postman actually? He or she knocks on your door almost every day. So yeah, say hello, ask how they are. In the supermarket, it's the same people working there. So maybe skip one of the online deliveries, do it every other week, and go to the supermarket and just have a look, if it's obviously safe. But it's the little things. Who are your neighbors? We don't seem to know our neighbors anymore, or only very few people know their neighbors. We had a lovely situation recently where our neighbor shared her lunch with us, and she just wanted to be kind That was all. She wanted to share kindness, and it was it never happened before, literally. So, but it doesn't have to be that way. So, yeah, look around.
So what we
share
learned from
the
this
happiness.
what we learned from this is, if you can do one thing, make it practical. Do one thing for someone else. The feeling that you will get is just incredible. The oxytocin level will go up. Ask them honestly and want to know how they are doing. Maybe do one practical thing by cooking or baking something and knocking on the door, as Natka said, or when you're in the supermarket, make it a conscious activity to ask the cashier how she's doing, and really see what happens when you actually pay attention. Like the body language for you as well is very important. So rather than, doing your shopping at the same time, just turn towards the person and look into their eyes. Eye contact has gone out of fashion. I'm from Central Europe, and eye contact growing up was one of the most important and most exciting things that I grew up with. I still remember it. And I notice when I go into a more conservative culture where people usually look down, I know these are small things, but they really do add up. So by opening your body and facing them and looking nicely into their eye with a comfortable side look from time to time, so you don't intimidate them, and a little bit of a smile. And it's not only good for the receiver, but somehow you get that positive energy from them. You're welcoming them. You're telling them that it's okay to talk to me. And the little touch on somebody's shoulder, yes, in COVID time, you can really do that. But if it is safe, then touching them on the shoulder, you create a bond that is super powerful. Small things, one touch, look in the eye, and see the little magic happen, and feel the butterflies in your stomach that you can only get from a human being when you connect with them truly and you really want to. So yeah.
Yeah, there's a very nice comment from Alison saying that during COVID times, neighbors reconnected to each other. And yeah, I completely agree. And I remember in the first lockdown, there was a forum of the neighboring streets, and people could ask for help. Where I remember we picked up some cat food or some cat medicine, things like that. So and just dropped it off, and it was lovely. It didn't take anything from us, but the kindness and the heartwarming feeling was amazing.
Absolutely. I think one of the most tragic phrases that has come from the COVID pandemic is socially distancing. Actually, that's not what we need to do at all. We need to physically distance, yes, of course, because that's going to protect us from COVID, but you can physically distance yourself, but socially connect with other people.
Exactly.
Yeah, that was just misphrased.
Perfectly said. Do you have any questions from our lovely audience? And please, if you feel like, do put your hand up, and we can turn your mic on so that we can connect here and have a chat. Don't be shy. So if you would like to chat with us, have a question.
And if you don't feel comfortable here, like Linda said, they're coming up with a forum. I'm more than happy for someone to literally drop me a message on Instagram just saying, can you help me with this resource? I'm not sure what to do here. We've all done so much kind of work and research and things into this talk. Of course, we want to share it with you, because having the knowledge is nothing. It's all about sharing it with other people.
Definitely. Good. No questions?
I have a question to the audience.
Yeah.
You can just answer in the chat. What have you struggled most with in 2020?
We have a shy audience today.
We have a shy audience. I might just answer myself. There we go. We've got one answer. Thank you.
Oh, Anita, one of the resources that I've got coming up is all about new mums, actually. It was some research that we did, and there's an app called Mush, M-U-S-H. It comes from Mumsnet, and it was by a new mum during COVID who's created small local communities to try and get people, because it's been such a horrible time to go through pregnancy and having a new baby. Of course, everyone has felt so alone, and it's so difficult. It's a new experience. I definitely encourage anyone to have a look at it, because it's just about connecting people when you can't go to, you know, mum and baby classes, having things on Zoom, having things over the phone, going for walks, sharing tips. I think they even have WhatsApp groups set up locally. So I definitely have a look.
That sounds lonely.
Yeah, it's hard. But Anthony just mentioned about traveling. Like with my partner Adrian, we travel. That's our life as well. So it has been, by now, by the end of the year, even though we worked a lot and it kept our mind off of this loneliness pandemic, the traveling has become an issue for us as well. And we felt like we are kind of locked in, and that causes anxiety for people who do travel all the time. But what we found is actually exploring our local area. That is as if for your mind is the same feeling as if you were traveling somewhere. So like do a trip in your area where you have never been, and look at it with eyes that you haven't used before, with an open mind, and going to your nearby parks that you have never been. You know, make it an exciting trip as if you were traveling somewhere. Here we are lucky with the Peak District, but even if you don't have a national park nearby, just explore your local nature, your local area. Just drive out half an hour and see what you find, and it really rejuvenates your mind as if you were traveling, and you won't feel so locked in. And surprise, surprise, you might just find some beautiful places that you wouldn't have. So that's another mention of what Natka was saying, an open mind to, yeah, just explore, see what you find. I'm sure you haven't been in every single area in your area code. So yeah, try it out and let us know. Send us a message what you have found and a few photos on the forum. Yeah, that's a good way.
I completely agree with that. Actually, Anthony, I'm very much with you. This is the first year that I've used my annual leave for something that hasn't been a holiday. And I think that's really common for lots of people who love traveling. But what I've then done with that time is learnt new skills. So taught myself the ukulele. Why not? I explored local areas. So actually, I've never been to, although it's really famous, Richmond Park, so close to us. And actually, it's beautiful. And you'll find that you'll create just as many memories as you do on holiday, just in a completely different way.
And I would also add that you can make your workday more interesting. If you know you've got a Zoom call coming up, it's going to last hours. It's like the annual review of whatever. Go to the park. Take your headphones. Go to the park. Take a bit of coffee with you, a biscuit, and listen there. So be brave enough to leave your home office. Be brave enough to step outside. And you don't have to sit by your desk all day long. And at the same time, now that I'm mentioning desks, I also have to mention standing desks. If anyone feels that they're sitting too much, I can highly recommend standing desks.
Definitely, it's a good way to be, getting the legs moving while you're talking, and all those deep vein thrombosis in your legs. So yeah, get them coming back. Exactly. There was another comment from, I think it was, I can't see the very first question, Erica, if you can read it out.
The first comment about boredom. I've run out of things to do and it's monotonous. That's from Charlie.
Yeah.
I know
So-
Siobhan's mentioned about learning something new, but sometimes I think people feel the pressure that they need to be doing something productive as well, and that could be a big pressure. For me, one of the things that I've tried to do during the lockdown is my husband and I, we like going out for dinners, for meals, and during lockdown we've not been able to do that, and to connect with each other at home we've been recreating things that we like to eat out, and that's been quite fun to do at home, but obviously everyone's got different ways of, you know, connecting with each other, and doing something fun, might be helpful to sit down with your family, brainstorm a list of things that you can do for fun, and that would be a great way to connect with each other as well.
But also at the same time, allow yourself to say, it's been enough. I can't do it anymore. So don't put pressure on yourself that you necessarily have to keep on going. If you're feeling up for a lazy week, do that, because there's nothing worse than just pushing through, not really knowing where the end is going to be. So take things as they come.
And I'm just noticing the time, and some of you might want to leave. So I before we go into the half-hour sort of chat with us afterwards, where we'll stop the recording, I'll just lead you through a quick breathing practice, and then for those of you who want to pop off, you can do that, and those of you who want to stay on and connect with us, then you can do that too. I will, if everyone can just make sure that they're muted so there's no background noise, and I'll lead you through a guided breathing practice. So first of all, get yourself into a comfortable position. You can either sit on the floor cross-legged if you like, or on a chair with your back straight and not leaning on the back of the chair. Or if you prefer to, you can lie down flat as well if that's more comfortable for you. And once you get into position, just keep your eyes closed. And if you prefer them open, then just keep your eye gaze down and just in front of you. Throughout this practice, I'd like you to use your nose to breathe in and your nose to breathe out. And when we're breathing, we want to use our diaphragm to breathe and not the muscles in our neck, our shoulders and our back. So just be very mindful that when you're breathing in and out, that your shoulders aren't moving up and down. And instead, we want our bellies expanding like a balloon as you're breathing in and then falling as you're breathing out. So today we'll do a slightly different breathing pattern to what we've done the last couple of weeks. And we'll breathe in for 4 counts and then hold for 4 counts. And then we'll breathe out for 4 counts. So I'll start, I'll guide you to start with. So if we take a breath in through our nose, 2, 3, 4. Now hold, 2, 3, 4, and out, 2, 3, 4. In, 2, 3, 4. Hold, 2, 3, 4, and out, 2, 3, 4. In, 2, 3, 4. Hold, 2, 3, 4, and out, 2, 3, 4. In, 2, 3, 4. Hold, 2, 3, 4, and out, 2, 3, 4. Just carry on at your own speed. Just remember belly rising as we breathe in and falls as we breathe out, and the shoulders shouldn't be moving, and breathe in and out through your nose, not your mouth. Now just come in again. So breathe in through your nose, 2, 3, 4, and hold, 2, 3, 4, and out, 2, 3, 4, in, 2, 3, 4, hold, 2, 3, 4, and out, 2, 3, 4. Remember breathing in through your nose and out through your nose. Shoulders shouldn't be moving. And now just breathe normally, but keeping your eyes closed for a second. And as we come to a close, just notice how you're feeling. You might be feeling calmer and more mindful than you did a few minutes ago. So I'd like to invite you to try this out when you're feeling stressed out in the next few weeks, or in the next week, in the next few days, and just try to repeat the breath cycle about 10 times. And this should take about 2 minutes. Now let's slowly open your eyes. Welcome back.
Oh, I'm very relaxed. Thank you so much for this breathing meditation. You can see if you did take part that it only takes a few breaths, and you're just a few breaths away from relaxation and connecting with your body, especially when you're stressed or somebody caused you to be upset. You can sit down and reconnect with yourself before you go back into your workplace or back into the conversation with your family. It just grounds you. So we have come to a close to this session. We hope that you enjoyed it. We would really appreciate your feedback to ensure that this platform continues to serve you. Feedback form will be sent out at 6:30. And to continue this conversation, please visit our website, connect with us on our forum, where we can have an open conversation. You can have a chat with our doctors. You can check out all of our resources there that we have talked about and much more. And if you would like to stay on to socialize and chat with us and each other, we will take a 5-minute break now. So you can go to the toilet and get a cup of tea, and just make sure that you are back in 5 minutes and relax, put your cameras on, and we can continue destroying loneliness. One cup at a time. So thank you very much.